A new blood test to detect colon cancer is on the horizon, or maybe as it waits FDA approval, something that could be a game changer when it comes to detection, with early tests showing an 83% accuracy. This is, it turns out, National Colorectal Cancer Awareness Month, and Dr. Sarah Schwertner from Primary Care Plus joins us to talk about this important issue. Good morning to you.
Good morning.
So I want to get to the test in a minute because you're not involved in that, obviously, but I think it speaks to something that a lot of doctors have frustration with. Let's start with the basics, if we could. This is cancer of the large intestine.
Yes. So colorectal cancer is cancer of the colon, and mostly the large intestine is made up of the colon and the rectum, so that's why they call it colorectal cancer. And it begins as a clump of cells that can turn into a polyp and later on can turn into cancer if not treated.
How common is it?
So it's the third leading cause of death in the United States. And so also in Louisiana, we have one of the highest rates of colorectal cancer in the nation.
What's fascinating about that is it's so detectable. And you know, when you talk about detecting polyps, it's almost preventable. So it's got to be a source of enormous frustration in the medical community that something that can be so prevented is still killing people.
Yes, and so it's really important that you talk to your doctor about what type of screening you want to get done, because if you catch something when it's this big and get rid of it before it's a mass, it can save your life.
All right, the study is not something that, you know, you're involved in. This is a national news story that people can Google on, you know, with a simple little Google search for it. But from a medical professional standpoint, what kind of a game changer would it be if there were a third basic option for detecting colon cancer?
It would actually be the fourth option to detect colon cancer.
Because there are two types of manipulation.
Yeah, right. And so I think it would get a lot more patients screened and prevent a lot more cancer, because no one wants to have, you know, the colonoscopy. Most people are kind of want to avoid it until it's time. And so if we had a blood test, that I think a lot more people would be willing to do that over having a procedure.
When you look at this, I mean, I'm sure you've encountered patients in your practice who are reluctant to get it, you know, because it is, you know, the two of the forms involve manipulating, you know, your own poo, and the other one involves fasting and then having somebody, you know, stick a camera up your behind.
Yes.
I mean, those are, a lot of people really are like, I don't want to have any part of that.
Absolutely. Absolutely. So I think a lot of people would be interested in doing a blood test. It's not as accurate as a colonoscopy, but at least we're getting there, and we could catch a lot more cancers, like they call the crucial catch, before they become, you know, metastatic. That's
a great point, because this blood test is not being billed as a replacement. It might be something that would get people who don't want to do the colonoscopy to you know, get the results there. What are the symptoms?
So some symptoms of colon cancer would be changes in your bowel pattern, so blood in your stool, loose stools, or constipation, or feeling like you're not completely emptying. And again, that's going to be something different than your normal stools. So
the other aspect of this that's just puzzling the medical community is the fact that this used to be kind of an older person's disease, was a perception, and still is to a large degree, people over 50. But now younger people are getting it, and the medical community doesn't know why?
Well, we do know why. I mean, it has to do with your diet. I mean, we're having a lot more processed foods, access to fried foods at 3 o'clock in the morning, 2 o'clock in the morning, people eating, you know, bad things. It can inflame the colon and cause cancer.
So moderation.
Everything in moderation.
Go ahead and have that fried chicken, but just do it in some moderation.
Right.
If you're doing it nightly at 4 o'clock in the morning, that could be an issue. Gotcha. Sarah Schwertner, thanks.
Thank you.